Yeah, that's another topic I'm interested in because, again, Romania doesn't have a national screening program for breast carcinoma, so we have a lot of tumors, of malignant tumors, of cancers. And those ones are detected in a late stage, unfortunately, and they also are related to high mortality. And when you deal with breast carcinoma, you also deal with the mimics. So this topic is related to the mimics, the lesions that are benign and should not be confused with the malignant ones. So that's why I think that this is a more, academical, didactical approach. And this lecture will be very good for residents and young specialists to be able to diagnose properly a breast carcinoma and to exclude these ones that are only mimicking invasive carcinomas. Well, radiologically, they can mimic. So first of all, we need good radiologists to detect them and to differentiate them. But then pathologically, when you gross the surgical specimen, they can mimic an invasive lesion as well. And then in the microscopy, if you are not very experienced, they can also mimic. So you have to have experience, to diagnose them properly. And then you have to use a couple of markers of antibodies. Ancillary studies show that you have to use more than 2 or 3 markers to be sure that they are not invasive. Absolutely, absolutely. And I personally think that we need trainings for young people, young pathologists and residents to let them know that these lesions are not malignant and they should not be diagnosed as malignant because, in the breast, the problem is that as soon as you diagnose as a malignancy, first of all, the surgical treatment will be radical. So you will do probably even a mastectomy in my country. And secondly, you don't want to oncologically treat that patient for something that is not malignant, So you want to avoid all these things. And that's very important to be able to diagnose pseudo-invasive versus real malignant lesions. Well, being for the first time here at the Congress, I truly appreciate this kind of congresses. And why is that? Because this is a multidisciplinary Congress. And for the breast and the GYN, I think this is the ideal situation in which you have a team working together. You have the surgeon, the oncologist, the pathologist, the radiologist. And this for the breast especially, but also for the GYN, this is the ideal situation. And I really want to congratulate the president and the organizing committee for having such a wonderful idea to put them all together, to be able to attend multiple sessions and, eventually to work as a team.